Good afternoon, everyone. Welcome to today's webinar presented by SAMHSA's Game Center with the support of SAMHSA, which is the Substance Abuse and Mental Health Services Administration. Today's webinar is titled Supporting Women's Reentry, Understanding and Addressing the Needs of Women Reentering the Community. I am Erica Ihara, and I am a project associate at Policy Research Associates and SAMHSA's Game Center for Behavioral Health and Justice Transformation. Before we start our presentations, I have some housekeeping items to review. First, our disclaimer. The views, opinions, and content expressed in this presentation and discussion do not necessarily reflect the views, opinions, or policies of the Center for Mental Health Services, the Center for Substance Abuse Treatment, the Substance Abuse and Mental Health Services Administration, or the U.S. Department of Health and Human Services. If you have any questions for the presenters or in regards to technology, please type them into the Q&A pod, which is located on the right of your screen. And we will be queuing up your questions for the presenters for the end of today's session. We've reserved some time at the end to answer your questions. We will also be conducting a couple of polls, and we appreciate your participation. So when you see a poll pop up on your screen, if you'd like to respond, we appreciate hearing from you. This webinar is being recorded and slides will be disseminated via the Games listserv following the webinar. We also notify you when the webinar recording is posted to the YouTube channel of SAMHSA. And finally, a certificate of attendance will be available for download at the end of today's webinar. And just as a reminder, this is a certificate for personal portfolio use. It is not for CEU credits. We are able to offer ASL interpretation for today's event. And so if you have not already done so, in order to view our interpreters, go to Layout in the upper right of your screen, select Hide Non-Video Participants, and then change the layout view to full screen, and then finally select View All. And we have two interpreters today. Their names are Jason Farr and Brianna Ralston. We have live captioning for this event, and to view the live captioning, select Accept in the Multimedia pod, which is located in the lower right of your screen. And the color contrast of the live caption pod can be changed as needed. We do recommend high contrast style for the best visibility. And next, I would like to introduce today's agenda. In just a few moments, John Berg will be giving some comments from SAMHSA. Then the presentations will follow, and we have reserved time at the end to address questions from the audience. Now, I'd like to turn this over to John Berg. He is Senior Public Health Advisor at the Center for Substance Abuse Treatment at SAMHSA for some opening remarks. And John, welcome, and thank you so much for kicking off today's event.
John, I'm sorry to interrupt you. I think we're having some sound issues. You'll make sure you're not muted on your end. John, if you could just check and make sure everything is working on your end. We see you're unmuted on the platform, but we aren't able to hear you. I still cannot hear you. Erica, I'm going to turn it back over to you if you and Ashley want to troubleshoot this with John.
Certainly. I'm going to move forward and introduce today's speakers, and we'll come back to John if we're able to get his sound back on. So first, we have Dr. Melissa Stein. She is Senior Research Associate at Policy Research Associates and SAMHSA's Game Center for Behavioral Health and Justice Transformation. She is the communications lead for SAMHSA's Game Center, and she also provides technical assistance to numerous communities nationally, including facilitation of sequential intercept model mapping workshops and providing training for criminal justice professionals on how to be trauma informed. Lisa Tipton is co-founder and executive director of Families Free, which is located in Johnson City, Tennessee. She serves on the team of several recovery courts in the state of Tennessee and holds a governor's appointment on the state's Criminal Justice Reform Task Force as part of the Mental Health and Substance Abuse Committee. She is active, as you can see from her bio, in numerous community work groups and committees that are dedicated to improving the lives of women and families in Northeast Tennessee. Robin Ledford is clinical director at Families Free. She is a licensed master social worker with expertise in counseling for people with drug and alcohol use disorders. She is an adjunct faculty member at East Tennessee State University, where she teaches in the social work program. Sarai Cook leads the National Trauma Awareness Initiative. She is an attorney with experience working at the community level, nationally, and also internationally. She is the recipient of multiple awards in recognition of her work with the Muskogee Creek Nation, including the Muskogee Creek Nation's Professional of the Year Award and the 40 Under 40 Award, which is given by the National Center for Native American Economic Development. So I'd like to welcome all of our speakers today. And now I'd like to just share some observations about who is participating in today's webinar. Thank you to everyone who has participated. And I apologize, I'm currently unable to see the results. So if I'm able to share that at the next break that we have, I'll share some observations about today's audience. So John, just a sound check. Are you able to connect your sound now? All right, so we are going to move forward to begin the presentations. So I'm going to turn this over now to Dr. Melissa Stein to begin. So Melissa, over to you.
All right, good afternoon and welcome everyone, or good morning, depending on where you're joining from. Thank you for joining us today. And I am Dr. Melissa Stein with Policy Research Associates and the Game Center. And I'm kicking off today's webinar to share a few of the recommendations for supporting reentry for women. And today I'm primarily focusing on a publication disseminated by the Substance Abuse and Mental Health Services Administration. It's called After Incarceration, a guide to helping women reenter the community. And this publication provides a wealth of information around supporting women. However, we will just touch briefly on the 10 recommendations so that we can quickly get to our presenters talking about their work there in the field. So at the end of 2019, there were nearly 108,000 women in state and federal prison. There were 110,000 women in local jails, but This greatly underestimates the impact of this issue. Those are just end of year counts. So this does not reflect the number of women coming in and out of those prisons and jails throughout the year. Similarly, the latest numbers we have around women under community corrections, this is just an end of year snapshot and doesn't reflect the number of women coming off of community supervision throughout the year. So we know there's an exponential impact on children and families, and women reentering the community face unique challenges. We see many of them have limited or interrupted work experience. They are facing challenges related to family reunification. If they have their children, they may struggle with dependent care needs and expensive childcare services. And then finally, they may need women-specific trauma-informed mental and substance use disorders. And just to ground us, this publication is really set up around a framework that is informed by work by Susan Covington and her colleagues. And their research has really helped us understand that a gender-specific approach is really critical for women. And women have specific pathways in and out of the justice system, and those are the things we want to keep in mind as we develop or shape a reentry program for women. So the first element of this framework is the specific pathways that are unique to women. And research is indicating that even something like lack of transportation can predict a woman's future arrest. So there are specific things that are impacting women differently than how they impact men, and can result in women's justice involvement. Women also have a different approach to a different developmental and relational approach. We all know there are some women who are engaged with the justice system because of their relationships with other people who are involved in criminal activity. So that's something we want to keep in mind. Racial and ethnic disparities and the intersection of race and gender disparities is also important. We know that women of color are disproportionately involved in the criminal justice system. So we want to be cognizant of that as we tailor reentry program for them. Trauma, as well as substance use disorders and their effects, also impact women differently than men and can have different implications in their involvement in the criminal justice system. So this framework just helps us understand better how women are engaging in the justice system, what reasons drive that, and how we can shape our reentry programming to be more responsive. And so the publication I mentioned at the beginning provides 10 recommendations. I'm going to move through these really quickly, but here they are at a glance. And the first one we want to talk about is identifying critical reentry needs. And I like to center these around the framework that I just discussed with you. So first, when exploring critical reentry needs, we look at the pathways of women going into the justice system and explore what housing, transportation, employment needs do they have. We look at relational needs around family reunification, child custody, what parenting education or parenting supports do they need. We look at racial and ethnic factors. So are women of color experiencing disparate treatment? Are they able to get appointments with clinicians and therapists? If they are able to get that appointment, are they able to access services from someone that understands their culture and can really speak to them where they are? And then finally, what are the needs around trauma and substance use disorders? And related to substance use disorders, I'm going to touch on screening and assessment in the next slide, but what we really want to emphasize here is that any medication that a woman is placed on inside a prison or jail, those women should continue that medication upon reentry into the community. And if they were on medication-assisted treatment prior to being incarcerated, then there should be efforts to see if they need to go back into that treatment after their release. And if there are concerns about that, then we really encourage you to look for community-based MAT providers that you trust, that you know they provide quality services, and will monitor their patients, ensure that the women are receiving the correct dosage, and ensure that women are responding to treatment as expected. So that's one important thing to keep in mind with substance use disorders. We also like to remind people that women will often put their family's needs above their own treatment needs. And so if the option is that a woman could go into a 2-week inpatient stay at a facility 3 hours away, and that woman has just been reunited with her children, we know the chances of her going into that inpatient treatment are low. So we really need to think through what might be some outpatient treatment options. What are some of the other supports we can surround that woman with to continue her on her path towards recovery, even if that inpatient treatment stay isn't a possibility at this point. And now, thinking about mental health services, and this often overlaps with providing substance use treatment. And I did say I'd mentioned something about screenings and assessments. So if you can, try to see if there have been any screenings or assessments done earlier. So if the woman has been in drug court, or maybe the prison she was at did some screenings and assessments. If it's possible to get that information, bring that into the process rather than subjecting the woman to more screenings and assessments, which can be traumatizing. And if you don't have access to screenings and assessments, or if you're interested in implementing one with your reentry program, SAMHSA does have a very in-depth document, the screening and assessment of co-occurring disorders in the justice system publication on this screen. And you can access this by pulling up your favorite browser, search for the SAMHSA store, and then on the SAMHSA store page, search for screening and assessment. And this publication will come up for you. It goes through a number of different screening and assessment tools to look at, to screen or assess for mental health, substance use disorders, trauma, and suicide risk. So that's a resource for you to access. I also just want to reemphasize that women of color in our program, they can face challenges. And the research actually shows that people of color are less likely to get an appointment with a mental health provider. And then if they do get that appointment, they're less likely to have services that really understand their culture, their values, and priorities. So we really want to keep that in mind, and where possible, link your women with services that are responsive to their cultural needs. And addressing physical and reproductive health is also important. Research shows that women engage with the emergency room or are admitted to hospitals at higher rates than men following release from prison or jail. And we know that women also face specific challenges related to reproductive health care. So you'll want to think about rates of sexually transmitted diseases. If they were pregnant during incarceration, what postpartum care did they receive? And if they're able to access affordable contraception. And providing culturally competent services, I've touched on this a number of times already, but it's important for the reentry program to ensure that you are providing culturally competent services. And what that means really is that you're able to provide effective services in cross-cultural situations. And SAMHSA has another publication that is extremely helpful, Tip 59, Improving Cultural Competence. This is tailored for behavioral health programs, but it translates very well to reentry program settings. And so this publication can walk you towards work that you can do to strive towards cultural competence at the staff level, the program level, and the organizational level. And we like to remind people that cultural competence is on a continuum. So sometimes we can be moved towards it, and sometimes we can move away from it. So we always want to be in a process of striving towards cultural competence. Another helpful SAMHSA product is their concept of trauma and guidance for a trauma-informed approach. And this publication provides a lot of definitions and terms, as well as guidance around shaping trauma-informed services and systems. Related to reentry programming, I like to emphasize the importance of training and education for staff, and just go ahead and adopt a universal assumption of trauma. Most women engaging with the justice system have a history of trauma, and the experience of incarceration itself can be traumatizing. So we want to make sure that your staff are equipped with the knowledge they need to recognize. Sometimes women might be reacting or behaving in a way that is just their way of adapting and surviving challenging situations. And so if your staff have the knowledge to recognize that, they can respond accordingly. So that training and education leads to trauma responsive services. And that should also include considerations of the physical setting. So if you can create spaces where women can feel calm, they can feel, they can relax a little bit and start to think more about their own recovery, then that's going to be very helpful. Part of trauma-informed services is also providing some healthy relationships and enabling women to have an opportunity to start to assume some control over the many aspects of their life that feel out of control. It's an opportunity to help provide them a choice and to foster their sense of autonomy. And building on that, building healthy, trusting relationships is going to be critical. Many women coming into the community with a history of unhealthy relationships, harmful relationships, and so many of them will need a lot of support around developing healthy, trusting relationships as upon reentry. And the professional relationships is an opportunity to model those appropriate supportive relationships, including healthy boundary setting. And as women learn from that modeling of healthy relationships, they can begin to think about what kind of family relationships do they want to foster. And I've got some more numbers here. Again, these are an underestimate. The 132,000 children impacted, that does not include the number of children that had a mother go through a jail. So, so we know many more children impacted. And women can face challenges related to if their parental rights were terminated during incarceration, or perhaps their child just lived with grandma for 5 years. And so they need a lot of extra support to help foster that relationship and rebuild that bond and trust between the mother and child. Equally important is going to be to support women regarding the financial burdens they face. Many women leave prison and jail with tens of thousands owed in restitution, fines, and fees. That can be an overwhelming burden. So as much as we can do to shape our reentry programs to address these challenges, that's going to help. Women also face challenges related to legal fees, related to child custody. Many jails and prisons charge fees to receive medical services during incarceration, and if the woman can't pay for it during their incarceration, they will owe it to the prison after they're released. So lots of fees can mount up, and we also know women may also have challenges regarding financial literacy. They may not be able to access important financial information if they have terminated a relationship with a previous partner. And I've already mentioned many of them have inconsistent work histories, or maybe they've had work that has been low paying and not paying a livable wage. So a lot of factors come into women really facing significant challenges in their financial wellness, and that we want to shape our reentry programs so that we can address concerns that could potentially increase the likelihood that a woman would return to an unhealthy relationship. We want to reduce the risks that a woman would return to potential unhealthy behaviors or criminal activity to address some of their financial needs. And this can be done in part by incorporating the use of peer support specialists. That could be certified peer specialists, peer coaches, and the presence of people who have been there, done that, who can tell the woman, I understand what you're going through. I got through it, you can too. That can help foster the woman's sense of self-efficacy. And research is beginning to confirm the usefulness of peer support. We're seeing that it is indicated in increased treatment engagement, improved quality of life, and enhanced hope for recovery. So those are 10 recommendations to help you think through providing supportive services to women reentering the community. But we want to move from these abstract recommendations to learning what is this like in practice in the real world, and how can we meaningfully serve the reentering women in your community. So I'm going to turn it over now to Families Free to share about their reentry program, The Path Out. And I'm going to turn it over to Robin Ledford and Lisa Tipton.
Hello, good afternoon. As Melissa said, or morning. I am Lisa Tipton, and I'm the Executive Director of Families Free, and I'm joined by Robin Ledford, our Clinical Director. And it's such a privilege to get to be on this webinar, especially with Dr. Stein. She and I co-founded Families Free, the program that we'll be talking about 14 years ago. And at that time, we had been developing a program, a mentoring program for children with incarcerated parents, and we had began working with incarcerated women here in our local jail. And the programming that we'll be sharing with you today from Families Free is what we've learned over the years. And we do incorporate so many of the principles and best practices that Dr. Stein went over in her presentation, because at the heart of all of it, we really do believe that people need a second chance. And when a woman is ready to begin a different kind of journey, we want to be there to meet them where they are. Families Free, our mission, as you can see, is strengthening our community by building the capacity of vulnerable families through education, intervention, and restoring relationships. Families Free over the years has developed streams of revenue, but more importantly, relationships with the different departments of the state of Tennessee that are listed at the bottom of this screen. The Department of Mental Health and Substance Abuse is the largest funder of the programming that we offer at Families Free. They fund the recovery courts that Families Free participates in, as well as the classes that we provide inside of different correctional facilities. Department of Corrections is also a new funding source that we will be working with that has just come on board. Then Department of Children's Services and Department of Health. Families Free also receives an appropriation in Governor Lee's budget. He is a huge champion of criminal justice reform and reentry. So the beauty of all of these relationships with different departments has allowed us to develop some really specific programming for different populations of women who are involved with criminal justice system. So as you can see from the tree, we have some distinctive populations. One of them is restorative justice. That would be the individuals that we encounter that choose to participate in the felony recovery courts. It also has a woven component. That's a program that we develop with Department of Health for pregnant moms and moms with babies that are up to a year old. Then our restorative recovery centers mostly with families that we have referred through Department of Children's Services. And what we see is often there is criminal justice involvement and incarceration that are woven into these different populations of women. And we found that gender-specific programming is just imperative. Women need to feel safe. They need to be in a group setting where they are able to share different experiences and work on trauma, work on safety, work on establishing all the different components of a healthy life. And as you can see from the tree as well, we have tailored those services in the communities where women live in our region. All the issues that were mentioned before, transportation, childcare, employment, all housing, all of those different things. We want to seek to remove any barriers to women being able to not only believe that healing and restoration and change is possible, but also to accessing those services.
Hi, I'm Robin Ledford, and it's an honor to be with you all today to talk about this very important topic. And I'm going to start by talking about Families-Free Integrated Treatment Model. As you see from the graphic in the center of it, we've got a referral process which flows down to our clinical and comprehensive assessments, to individualized treatment planning with these ladies, and also branching out into our services that we provide just within our continuum of care. But also, as you see around the outer ring of this graphic, establishing and leveraging community partnership is such an imperative component for our reentry services with these ladies. Because as we've talked about before, there are some services that we provide through Families Free, such as parenting, education and services, and information and support around bonding and attachment, trauma-informed care, recovery skills activities, also mental health services, but we also have to partner with community agencies for medical and dental services. So when we're planning the reentry with these ladies, we're looking at it from a very holistic approach, and how can we meet their needs between a combination of what Families Free can offer and our community partners can also bring along to help. So the next slide I'm going to go to is just a visualization of the path out. And if you look at this from a very high level, and we're working with these women, oftentimes we're encountering them while they're still incarcerated, working with them in the 5 local jails that we're in. But what we're looking at is these often generational patterns of maladaptive behaviors and experiences of domestic violence, high ACE scores, socioeconomic disparities, lack of education. Oftentimes there are still active substance use disorders or untreated mental health, lack of self-worth. So trying to really begin to visualize what is this path out and what services need to be provided to move them towards these more adaptive patterns that lead to a successful reentry. So economic stability, employment, through treatment services, personality integration, a sense of self-worth, increased resiliency, and family relationships either restored or either understood what boundaries need to be there, and some natural supports added into their social circles. So the next slide I'm going to talk about is Maslow's hierarchy of needs. And this is really the model that we use to build our intensive case management services. And I say intensive because it really is a foundational piece of the services that we provide. So as I said, we often encounter these ladies while they're in jail, either through our jail classes, recovery court assessments, or with some specific grant funding to some of the counties we're in, where we're able to go in there and do reentry services, where we use the GAINS reentry assessment tool. So we're working with them to just understand, first of all, how to meet their basic needs. And on that level of Maslow's hierarchy, a lot of times we encounter these women and they'll be, they have been incarcerated for several months. They may have been locked up in winter and released in summer. So all they have is, winter clothes, the one outfit they wore in, or vice versa. So we'd like to, ideally, if we can, and we're working with them on their release, we will send someone to meet them, our case manager, to actually pick them up from jail. There will be a plan in place where we worked with them, or if there's an involved supportive family member, we will have, with the release of information, been working with that family member to try to have that smooth as possible transition back into society. So when we pick them up from jail, if there is no support, natural supports, that looks like us taking them to get toiletries, some clothes, a few days worth of groceries until we can get them set back up on EBT, helping them have access to safe housing, sober housing, either through a partnership that we work with Oxford Houses or other agencies, or Families Free has a transitional home for women and children called the Story House that we'll talk about a little bit more later. And that naturally begins to move them into that level of safety and security. And then we look at the belonging and love and this esteem needs. Families Free has a very relational approach. So when we're encountering these women who are incarcerated or being released, we are seeing this woman as an individual. We are seeing this woman as, not just where she's at right now, but what's her potential? What's her hopes and dreams? We see her as this individual, oftentimes mother, child, sister, and that's the way we begin to relate with these ladies. And oftentimes, these treatment relationships are the first model of healthy relationship that they've encountered. And through this, we begin to move them up this hierarchy. And the goal to this is moving them from that external motivation to internal motivation. Because oftentimes, external motivation is a great place to start. They don't want to be incarcerated. They don't want their children involved in the system. They don't want to be violated. So that's a great place to start. But as we move them up this hierarchy, it's about connecting them to themselves, to healthy supports, to their story, and to a life they don't want to escape from. And that's that internal motivation, which is a key component to that successful reintegration into society and to be able to sustain that. The next slide is a pyramid. It kind of reflects three sides of our treatment methodology. So on the one side is our evidence-based treatment, and that's where we're working with, of course, Hazelden, the different modalities, criminal addictive thinking, to meet this individual's needs, gender-specific, mindfulness, yoga, just to list a few. The bottom layer is the intensive community-based case management that we've talked about and that concrete support. And then that other side is the faith-based compassionate values. And that is at the heart of Families Free as an agency and our staff. And it's where I've already kind of spoken about, where we meet that individual and we treat them with dignity and the inherent worth, and we see the potential. And that's that very relational approach. And in the center of that pyramid is the one day at a time recovery coin. And so for women in treatment services, there are two sides of the coin that must be addressed. Self-responsibility is a built-in component to a lot of the curriculums. It's a built-in component to the structure of recovery court programming and a lot of criminal justice programming for reform. It's built into the 12-step community. So that one's a little more evident and integrated. Self-compassion is the other side of that coin. And that's where we work with these ladies through treatment to really connect to their story, to really understand what is their journey and their path out, help them connect those pieces of what brought them here, help them to see that, a lot of things that have led them to criminal justice system have just been survival skills. And so there was a need, an unmet need. So what's that intrinsic need that they have? And how can we help them connect to that and meet that need in a healthy way? And that is the tool of self-compassion. And that helps with that integration. So I think the balance between self-responsibility and self-compassion really moves that person towards personality integration or wholeness, which is another key component to that long-term sustained recovery. And the next couple slides are just some of the examples of services that we provide. The clinical assessment, individualized treatment planning, mental health evaluation. A lot of times we'll know their release date, we're picking them up. We'll already have their mental health evaluation scheduled through our mental health provider. Access to medications. We work with a local pharmacy, and that way, while we're working with this lady to either be put back on insurance or access to insurance, or before she's employed, we're able to pay for and get these mental health medications. We work with them for access to medical and dental care. That's also one of the first priorities, reproductive health care with the local health departments and local agencies that work on a sliding scale so we can get these clients involved in their physical health, criminal and addictive thinking curricula, trauma-sensitive therapy, trauma processing modalities, safe, sober, and stable housing. We use women's Oxford houses, women and children's Oxford houses, and I'm excited to say that's an area that we're looking to expand on. We've already got a project in the works, so we're really looking to more than triple our capacity for women and children's home and housing. Relationship counseling, social life skills, the transportation, we're working with them through our own employees' vehicles, through some families' free vehicles that we own, working with them if they don't have a valid driver's license, what's required for them to get that. We help them through a budgeting agreement where they can pay for fees and fines or whatever that they need to do, the consequences to get their driver's license, and then we'll meet them by paying half of their reinstatement costs. So really helping incentivize these successes along the way and celebrating these successes. And then access to educational and vocational training. Right now we have 5 ladies who are enrolled in either the first or second year of college. Access to childcare, another big one. We work with a local childcare agency to help that's close to our transitional home through Families Free. And that's an area we're also looking to expand on to try to bring some of that in-house as well. So we have some of that in the works. Working with them for family services, community support through local churches and 12-step groups. And the last one I'm going to talk about is helping them navigate multi-system involvement through criminal justice and oftentimes child welfare services. So helping them understand, and schedule, okay, what days do you have to see probation? Do you have a ride to probation? How much do you have to pay? What's their goal with children and reunification? If their child is either with a family member or in state's custody, helping to understand what is this woman's goal as far as reunification, and helping get her stabilized, begin connecting with DCS or the state to let them know that she's in our services, to let them know that she's working a plan. And as we work with her through stabilization, oftentimes what we see is a permanency plan for her to regain custody or access to her children are often the same steps that we're working with for successful reentry into society. So those things, if they're not the same, they're complementing each other. So helping them to the point of taking them to the courthouse and actually filing the petition as we walk them through it. So those are some of the services and some of the details of how we work with these ladies in our community. And I'm going to turn it back over to Lisa.
And I'm happy to be able to share about the people in this picture. Families Free really does believe so strongly that the best way to change the system, to improve the system, to be involved in criminal justice reform is to be involved in the courts. And that's why we absolutely value and prioritize our recovery court component of Families Free. And the 2 judges in this picture are our first judicial district criminal court judges. And those 2 judges see around 8,000 individuals a year in the first judicial district of Tennessee. So all of the experiences that they have walking the path that Robin described with our participants is such a powerful force in informing how they view all of the different clients that they see over a given year, which are a lot, because all of those people are individuals. They all have families. Most of the women have children. And this is one of the girls who came into our Felony Recovery Court program. She was 7 months pregnant whenever she came to us. And we all as a team felt like the best option for her would be to come and live in the story house. The story house that Robin described, we use a model where the women don't pay anything to live there. They are required to get a job. They enter into a financial plan with us, but that plan is totally geared to where they learn to pay their probation fees and fines that Melissa described earlier. If they have them, they may owe child support. They need to pay certain fees to get their driver's license back. And then to have a budget for transportation costs and insurance and all the different things that go along with taking care of yourself and taking care of your family. So during their time at the Story House, they are able to learn how to address those issues while living in community with other women and having all the support that Robin mentioned. So Kelsey came into the program. She had Paisley during the pandemic, which was just wild and crazy, but she had Paisley and they are still living at Story House. She is seeking independent housing now. She has a job. She's stable. The graduation balloon was for when she graduated from the GED program. So she has accomplished so many milestones and she owns all of those. And just to see her self-concept and her self-esteem because of all the things she's been able to accomplish, that has just blossomed. And now she is that strong, healthy role model for her daughter. And we are all celebrating all her successes. So she has a whole team of cheerleaders cheering her on as she moves forward. And we wanted to include another couple of visuals. Those ladies that are in the picture with me are the original ladies who moved into Story House. All of the women in that picture had experienced incarceration. Most of the women in that picture came into our felony recovery court as well. And the picture below it was taken at one of our family engagement days. So those are the family members of our participants. So when we say we engage with a release of information, they're family members that are healthy, that are supportive of their recovery in the planning, in the parenting education, and be part of that reunification process because that's difficult. As Dr. Stein had said earlier, Grandma may have had that child for 5 years while this lady was either in active addiction or incarceration, and usually a combination of both. And so we engage those family members. How can we all come together for the good of our participant and for the good of the children involved? And how can we strengthen those natural supports? And in doing so, what we're seeing is communities changing because these children are in our school systems. They are out in their community. And when you think about ACEs and trauma-informed care, it's all these people that you see in that picture. It's the little children, it's the parents, it's the grandparents. Everyone is affected and everyone can be part of the solution and the healing. And we at Families Free believe that's how we're going to change our communities. So I would like to turn it over now to Sarai, and she will be taking it from here.
Good afternoon, everybody. My name is Sarai Cook, and I'm a formerly incarcerated attorney licensed to practice law in both Oklahoma and Washington states. I was incarcerated in the state of Oregon in 2003 and released in 2004 after many arrests leading back to 1991 when I was still a juvenile. A series of events led me to the realization that I could do more with my life than continue the cycling through in and out of the incarceration system. And I was willing to do whatever I could to make sure that I wouldn't need to be away from my daughter, who was 7 years old at the time of my incarceration. I immediately enrolled in Portland Community College and then University of Portland, and then went straight to law school upon graduation in 2008, and I finished law school in 2011. I remember when I went to Portland Community College, I had a 4th grade math level. I started out in Math 20, and I knew that I had to get all the way through college level algebra. And so I went to my Math 20 teacher, which is basically someone that teaches fractions and multiplication tables. And I asked I asked that teacher, do you think I could make it to calculus? And that teacher said, that's going to be really hard, a really hard thing for you to do. And I said, I think I'm going to do it. And I took math every single semester for 2 years and made it to calculus. And I remember going to the tutoring center and just crying because I just couldn't get it. I couldn't understand, and it was really hard for me. And but I did persevere, and I did make it. When I went on to the University of Portland, I didn't let them know that I was formerly incarcerated, but they did know that I was a single mom who was a teen mother, and I was really out of my element there. I felt like I belonged at Portland Community College because there were a lot of non-traditional students there, but there weren't any non-traditional students at the University of Portland. There was a lot of privilege there, and I was surrounded by really young students and that didn't have any work experience, didn't have any life experience, and I had basically just got out of prison. So, that was a really difficult time for me, but it really prepped me for entering into law school because law school is a pretty hard place to be. It's very rigorous. Sometimes you have to read 50 cases a day, 100 cases a day, and surrounded by people that, grew up at the dinner table with lawyers and judges and politicians, and they just speak a whole different language. But I was able to complete law school, and advance this slide. Then I went to work for my tribe, Muskogee Creek Nation in Oklahoma, where I was the director of community research and development. I applied to become a member of the Oklahoma Bar Association. And after being grilled by 20 attorneys for 3 hours, I was deemed fit to practice law after documenting and demonstrating the horrors I had experienced as a child, including the foster care system, severe abuse that I had experienced in the foster care system, and other violent crimes that I had endured, including being a gun violence survivor at the age of 15. In 2013, after taking the bar exam 3 times, I finally passed and continued to work for my tribe, as well as taught for the tribal college and worked in private practice. In 2014, I went to work for the United States Department of Energy as their national program manager for the Office of Indian Energy Policy and Programs. While I was able to serve Indian country well in that capacity, I always felt a calling to work as closely with the grassroots as possible. So I left the Department of Energy and went back to work for my tribe after 3 years of federal service at the GS-14 level. I went back to rural Oklahoma from Washington, D.C. and worked one-on-one with tribal members being released from incarceration. While I did enjoy working one-on-one with tribal members, it was hard to see the systemic injustices every day, and it really broke my heart. I was spinning my wheels driving all over Oklahoma to make sure my brothers and sisters were not being unfairly and unconstitutionally being locked up simply for being poor. Through a series of events, I came to the understanding that my trauma was seriously hindering my success. Working within the criminal justice system, I was constantly being triggered. Through research and life experience, I found out about trauma-informed practices. This happened through my experience with the Kaiser Permanente healthcare system, as well as the Indian healthcare system, IHS. I remember when I came to Seattle, I currently live in Seattle, I came here to work on criminal justice system reform. I had been given through my employer, Kaiser Permanente health insurance. I was always used to going to Indian healthcare services, but I decided to give Kaiser a chance. So I went there and I was really surprised at how they treated me. They treated me kindly. They listened to me. They ran the tests I asked them to run. They were very transparent in how they treated me. They documented all of my patient notes and showed them to me online. And I really didn't understand, why I felt so good there, why I felt comfortable there. I'd always gone to Indian Healthcare Services. I never wanted to go anywhere else because within the healthcare system, anywhere outside of Indian Healthcare Services, I felt like I was treated poorly. I felt like I was looked down upon, patronized. They didn't do what I asked them to do, even though I know what's right for my own body. So I started to ask around about Kaiser and why they treated people that way, and I found out that they use trauma-informed practices, and I found out that they did spearhead the first ACE test, adverse childhood experience, and then from there I learned that I had really not known how my own trauma was affecting me until that point. So I learned a lot more about that. And it came into, so once I started doing my research and learning about this, I went to my employer and I told them, I said, well, if Kaiser Permanente can become trauma informed, why can't jails and prison become trauma informed and utilize trauma informed practices? Why can't all of the public agencies that touch people that are women and men or whoever that are formerly incarcerated utilize trauma informed practices? Why can't nonprofits that touch the formerly incarcerated or incarcerated utilize trauma informed practices? If doctors who they have a lot of privilege can learn these techniques and utilize them, then we should all be able to learn these techniques and utilize them. Since trauma is so prevalent within the formerly incarcerated community, it seems that becoming trauma informed is an important part of helping women to reenter after a period of incarceration. I believe that helping women in a trauma-informed way is one of the most impactful changes we can make when providing services. Because without it, many women won't access services because they'll be too triggered to access those services. If there's too much paperwork, if there's too many barriers to access service, if people are having certain attitudes or sort of exercising their biases against formerly incarcerated women, women will just stop trying to access those services. So in order to let everybody have equal access to those services, I believe that utilizing trauma-informed practices is necessary. That's why I founded the National Trauma Awareness Initiative. We hope to raise awareness around the prevalence of trauma in public services that help the formerly incarcerated. At this time, I'd like to offer some policy suggestions. I'm going to offer these suggestions in the context of a story. When I first started working within the context of the criminal justice system reform, I didn't have the right way to think about or talk about or the words to frame my thoughts and speak intelligently about system reform. On many occasions, I said in meetings that I was grateful for my period of incarceration. Now, upon reflection, I see that I wasn't grateful for my period of incarceration. I was grateful for the resources that I gained access to due to my period of incarceration. Inside prison, I gained access to cognitive behavioral therapy, 6 months of intensive drug and alcohol treatment, job skills such as typing and welding, the gift of time to reflect and read. I read a lot of books about mindfulness and became more self-aware and gained the ability to self-reflect, which up until that point of time, I didn't have any of those skills. For 24 years, I believed that every thought I had was true. I gained the ability through cognitive behavioral therapy to question my own thoughts and values. I can't speak for every incarcerated woman, but I can tell you that every single incarcerated woman I know has both severe PTSD through childhood trauma or domestic violence trauma or sexual assault trauma. Every incarcerated woman I know has self-medicated these traumas through excessive use of alcohol and or drugs. Substance use and abuse is a symptom of the problem. I hope we can all work together to give access to resources before the need for incarceration is present. In order for women and girls to benefit from therapies, their basic needs for food, clothing, and shelter need to be met. Once the basic needs are met, then other interventions become possible. The opposite of addiction is connection. Identifying recovery communities and other healthy communities is a key to helping people stay connected. Affordable housing, I believe, is the #1 need for women getting out of prison. We need to work to remove barriers to low-income housing. We also need to provide and help gain access for women to therapy and specifically trauma therapy. I know for myself, it's been very hard to get access to specific trauma therapy, EDMR, and specifically trauma therapy. I finally did get access, and I'm an attorney, and I have Kaiser. I have some of the best insurance, and it's still hard for me to find, and I still have not found a woman of color that can provide to me specific trauma therapy in the ways that I know that I need to be helped. Still to this day, after hours and hours and hours of researching and trying to find someone, another person of color that can provide the specific trauma therapies I need, I have not been able to find. So if I in this position of privilege of having really good insurance and having good research skills and persevering, even though there are roadblocks, still cannot find what I need, it makes me wonder how someone that didn't have all those could find the help that they need to move forward. Jails are also a good place to have early interventions because both these places, they remove the need to feed and clothe and shelter yourself. So they're good places to offer a reset and give some life-altering interventions. So interventions can start even at the first day when someone goes into jail. We also need easily available drug treatment programs and more culturally relevant drug treatment programs. I know for my tribe in rural Oklahoma, we cover 9 counties, and we don't have any, not even one drug treatment program in all of our nation. And the closest drug treatment program is in Ada, Oklahoma, which is run by the Chickasaw Nation. Culturally relevant drug treatment programs for women of color and cultural relevance is key. We feel more connected when the treatment practices are culturally relevant, and being culturally relevant is trauma aware. A good way to do this is through peer support. That means employing other people that look like us and have the same life experience as us, and also as the program participants. Creating access to revenue is important and resources to help pay off fines and fees owed to the court. Many women won't have good enough paying jobs when they're released and won't be able to afford fines and fees. It's my opinion that courts shouldn't be funded off the backs of poor people anyways. But yeah, people come out owing so much. And if we can have unrestricted funds and write in our grants, or even if the federal government or funders can allow to have unrestricted funds so that we can pay off fines and fees, help to get women, we're not helping women get ahead, we're helping women get back to zero. So as much as we can do to help them just get back to where everybody else is basically when they're getting out of prison would be really helpful. So I really think there needs to be a shift in thinking around that, because I think a lot of funders and even the federal government think that that would be sort of giving people an advantage, or they're not able to fund those things. But I think anything's possible if we shift our mind and we start to realize that, we need people to get back to a place where they at least have a chance to get ahead. We need to streamline the process for criminal record vacation or expungement and develop resources and assistance with the process as part of our social service programs. The federal government conducted a study about the effects of a criminal record and found that there are approximately 47,000 collateral consequences that come with having a criminal record. I'm happy to share the study with anybody upon request. A criminal record truly is a life sentence. We need to find a way to give women, who are the backbone of our communities, a second chance. And that second chance can't come without a clean record, because people are able to access and discriminate against women that are formerly incarcerated or that have records, unless we can give them the real second chance would be to not have a criminal record at all. That would be a real second chance. I'm going to be super vulnerable right now in telling you this, and it's actually embarrassing to admit, but even I, as a licensed attorney, teacher, and advocate, I still struggle with the effects of complex post-traumatic stress. I still have economic security and housing insecurity, even after almost 20 years post-prison. I still have a very large criminal record. And even when I go to, rent a place, rent a house, I'm always afraid that I'll be denied. And I have been denied on multiple occasions, and I have been denied for employment as well. I'm telling you these things because I've been gifted with the ability to articulate my struggles. A lot of people in our most vulnerable communities are not able to articulate the hows and whys of their experience without some training and detachment from survival mode. So I'm here to utilize my voice and my training to let everybody know the struggles that I continue to have post-prison, even 20 years later, with a law degree and the law license. Now I'm going to talk specifically about Native women and my recommendations for helping Native women. Many Native women, including myself, have found healing through the medicine wheel. The medicine wheel teaches us that all things are interconnected and interdependent. When we heal ourselves, we heal our families, we heal our communities, and we heal our nations. The medicine wheel's teachings come from the Red Road to Wellbriety. The medicine wheel teaches us to recognize that we all need to be aware of various parts of ourselves. These parts include our physical, spiritual, mental, and emotional well-being. It's important for service providers to make space for Native women to honor these different parts of ourselves, to help remind us to take care of our mental health and to get the supports we need. It's also important for service providers to honor our spiritual well-being. Many Native women use traditional medicines to heal ourselves. It's important for service providers to honor our use of these medicines and see these medicines as the same as psychological supports. Also, consider having medicines such as sage and sweetgrass on hand to give out to us. It's important for service providers to understand the Indian Child Welfare Act. For most Native women reentering from a period of incarceration, getting our children back will be top priority. Lack of knowledge and failure to comply with ICWA today is endemic within child protective services. The main thing that you should know is that the standards for families covered under the Indian Child Welfare Act are active efforts. Active efforts. To prevent the breakup of Indian families, active efforts must be thorough, timely, consistent, and culturally appropriate. This is distinct from the reasonable efforts requirement in non-Indian child custody cases because it requires both a higher level of engagement with the department and culturally appropriate services. ICWA is a powerful tool to keep Indian families together. So it's important that we all know about it, get training, get informed about ICWA so that we can make sure to advocate for Native women effectively. Recognize the importance of lived experience. No matter how many trainings you go to, the most helpful knowledge will come from the actual people who have lived the experiences with barriers and challenges when seeking support and advocacy after a period of incarceration. Listen and understand that systemic inequalities are real, and Indigenous women are living with inherent injustices within policing, corrections, and court systems. When you're listening actively, you are practicing cultural humility. This will hopefully lead to a self-examination of your unconscious biases and stereotypes. I'd like to invite any of the participants today. If you have any questions for me or you'd like to contact me, here is my email address, soraya@traumaaware.org. This is NTAI, National Trauma Awareness Initiative's website, www.traumaaware.org. And then you can also find us on our YouTube channel. NTAI is our YouTube channel, where we will be having impacted people come on and talk about their experience with trauma and how that led them to the criminal justice system. So with that, I'll hand it back to Erica. Thank you, Erica, for this opportunity.
Thank you, Sarai, and thank you to all of our presenters today for these incredibly informative presentations. We have a lot of questions from the audience. We probably won't have time to get to all of them, but I'm going to just go through some of the questions, especially starting with we heard some of the same questions from a number of people in the audience. I'm going to kick off with a question, and I'm going to start with asking Dr. Stein. This audience member says that they understand that women tend to enter into the formal criminal justice system with more barriers, like more extensive mental health issues, higher criminogenic factors, oftentimes because they're dismissed at earlier interactions, and so they remain in the community without appropriate services. And they want to know, is this a myth or a fact?
That's a good question. I think that there are many women who may have engaged in what we consider more low-level criminal activity, misdemeanors, who may have not had access to the appropriate resources and supports earlier in their experience. And so we'd have to look at the research to see, are women at a more severe place in life when they come into, say, prison? And I'd be interested in hearing from the perspectives of our other presenters what their perspective is. I will say that some of our other work here at the Gain Center is focused on looking at the sequential intercept model. So looking at each intercept point across the justice system. We know that there is a dearth of research resources prior to justice involvement, and even at that arrest phase, there's a a lot of resources needed to divert people effectively from the jail. And so we know that that's a reality. So it's possible that people are not getting the resources they need in the community and then presenting more severe symptoms once they come further into the justice system. If our other presenters have any thoughts on that, feel free to chime in.
Sure. I do have some thoughts on that. We most definitely see that here in Northeast Tennessee. And as I had shared, we have a pretty broad base of referrals from different points in our system. And the majority of our clients are what we would consider system involved individuals. And I am a huge advocate for someone getting the appropriate level of care when they intersect with the system, whether that be in the ER, in the pediatrician's office, in the OB office, with Department of Children's Services, or the criminal justice system, because that is a point in time that they may be open to those services. And using the disease model of addiction, I think it's quite evident that that does continue to progress, and that usually means more severe manifestations and consequences the longer that goes untreated.
Thank you. So we have quite a few questions about insurance, and so I'm going to present this question to Families Free and also Sarai. So a couple of people would like to know, just if you could talk a little bit about ways to think about being able to access care for women, for healthcare, and including when somebody doesn't have access to insurance, and what are some strategies that people can do to expedite turnaround times and to be able to access gender-specific behavioral health and medical care. And whoever wants to start first.
For access to insurance, some of our ladies do qualify for teen care. We have to work with them to get those benefits reinstated post-release. Some do not. We have worked with a local agency for some community health insurance that's specific to offenders. We found that to be a great resource where we can help them get access to some benefits that will at least help them with their primary care. And then our partnerships with local health departments and medical clinics with our university that's local, that provides services on a sliding scale. And that's where we come in and work with them to help them with some funding until they're able to get to the point of employment and have some economic resources of their own coming in. So, and we are grant funded through Families Free. So anybody that comes into our services is not paying for any services.
I'll speak from a Native perspective. It's important that people are enrolled in their tribes and that they get their children enrolled. A lot of times people aren't getting their children enrolled when they are eligible for enrollment. And when you're enrolled in your tribe, then you're able to access any Indian healthcare services, even the ones that are in cities or that aren't necessarily, even other tribal healthcare services and other. So let's say I'm Creek, but I'm in Seminole Nation or Choctaw Nation. I can still access their Indian health care services there, or even over here in Seattle, I can access the Seattle Indian Health Board and other tribal services no matter where I go. And so what I see a lot of times, though, is that people aren't enrolling their children in a timely manner. And so the children aren't covered under Indian health care services that way. But I always advise everyone to make sure that they get their children enrolled and let them know about their rights to access any Indian healthcare services all over the country as needed.
Thank you. So in the interest of time, I want to try to combine a couple of questions that came in around racial and ethnic diversity and cultural competence, cultural responsivity. So everyone here on the panel is working with different populations based on where you're located in the country. And Sarai talked a little bit about some of the specific things to consider when working with the tribes. Lisa and Robin are working in a rural area. And I wanted to know if maybe each of you who would like to provide like one or two strategies to think about how to provide culturally responsive services and how to engage partners to start thinking about what it really means to be culturally responsive. Like, what are some of the questions that your stakeholders and partners need to be thinking about when they're thinking about not only the needs of women, but women in combination with the racial and ethnic makeup of the region that you're working in? And that's for whoever would like to respond.
Well, I'll jump in. One of the things that we have found over the past 14 years of Families Free is whether we are dealing with judges, decision makers, parts of the team, which we would typically consider our stakeholders, and our larger state government, or we're on the other end of the spectrum and we are engaging families in the situation that they find themselves in, or women who come to one of the classes that we do in jail. We have found it so beneficial to understand what really is going on, to understand how the different systems work together, what their guiding principles and values are, and what the women that come to us for help say they need, what they really need. And rather than taking a top-down approach or a build it and they'll come approach, we really try to get in there and just really be very grassroots and understand what the different systems are seeking to accomplish, and also what the individuals need to have in their life to feel as though they are really being helped.
Thank you. Would anyone else like to add?
Sure, I'll add. When I got out of prison, I went to the Native American Recovery Association. There are a lot of resources out there for Native people to get into treatment and have aftercare. And it was so important for me to attend a culturally specific, a Native recovery place. So important. We do things different. We do value things differently. And I don't think that there are those are specifically for Black folks, for Hispanic people, Latinx people, specific treatment centers for them. And I really want to encourage people, funders and the federal government to fund places that are specifically culturally tailored to these various populations. It's not good enough that we're not of this. It's not good enough that we're not of the same race and we're not of the same culture, but we're trying to understand you and we're trying to implement culturally relevant practices based on our own understanding. We need actual culturally relevant, we need, actual really culturally relevant treatment centers for diverse populations, not just the dominant society basically trying to understand. Because to be completely honest, you're never going to get there. And I know that from attending actual Native run, tribally owned recovery centers, and what the difference in the experience is and how much more accepted and understood. I needed that to heal. I had to have that to heal.
And Erica, if I could chime in, a lot of the research does indicate that particularly women of color aren't able to access, much as Sarai has already said, they're not able to access treatment and clinicians that look like them, that can really speak to their specific needs. And so bringing that to everyone's attention, we just encourage you to think through what might be some creative ways we can overcome those barriers. So with the pandemic, we have seen an increased use of telehealth. Is it possible to use telehealth to link people with culturally responsive providers, maybe outside the community, so that the women you serve can get the treatment and the attention they need in a way that really responds to the things they want to address and the priorities that they have. So that's one of the reasons we bring that forward in the SAMHSA publication related to women's reentry. It's just to encourage you all to think more creatively to ensure that you can leverage resources to ensure that women can access the services they need, and hopefully work with clinicians that look more like them and understand their culture and their backgrounds.
And also, I'd like to add, in the meantime, if it takes a while to start to develop these systems, but in the meantime, I think having peer supports that reflect the participants is really helpful, and also giving peer supports power and giving them the opportunity to stand up for the participants and to be listened to. And so they don't have to be afraid to go to the heads of these organizations and tell their truth and tell the truth of the participants as well. Because a lot of times peer support, that's kind of a lower on the level, so they don't have a lot of power. But to give them that power and to really listen to them and their recommendations is really important.
Thank you for that. And I am so sorry to say that we are coming to the end of today's event. So I have a couple of items just to wrap up today. First of all, I would just like to point all of our presenters to the chat box. We got so much positive feedback from the audience today, and clearly a lot of interest in what everyone had to share today in their presentations. So if you haven't already, please check out the chat box and see all the great feedback that you got. We have a couple of documents on offer today if you'd like to download them. First of all, the after incarceration document that Melissa had talked about at the beginning of her presentation, and then also the attendance certificate. So if you'd like to download one or both of those, go ahead and select those two titles in a file transfer box that should have popped up on your screen just now, and hit the download button, and that will start the process for downloading the materials to your computer. And here are a couple of webinars that we have in the coming weeks, also hosted by the Gain Center. We have a webinar next week on jail and prison in-reach programming, featuring 3 programs. And on September 1st, we have an early diversion discussion group, and that is going to be focused on the role of certified community behavioral health clinics. And then finally, on September 2nd, we have a webinar focusing on culturally relevant approaches to support Native American people who have justice involvement. So we hope that you can join us. And if you're not already subscribed to the Gains listserv, we encourage you to do that. This is the address where you can register to receive our notifications, and you can receive announcements about the webinars I just mentioned, as well as other events and trainings that we have available. And finally, this is our contact information at SAMHSA and at the Gain Center. And so if you have any additional comments for us or requests for information, please do not hesitate to contact us. And we do have one last poll that has popped up. If you'd like to enter any information for us on feedback or information about other TA that you're interested in, we do share those results with SAMHSA. So if you'd like to provide feedback there, we welcome your input on the poll. So once again, I'd like to thank all of today's presenters and everyone in the audience, and I hope you all have a wonderful afternoon. Thank you.